Ulnar nerve flossing is a neuromobilization technique for the ulnar nerve. And if someone's having pain, numbness, tingling along the distribution of that nerve, whether it starts within the brachial plexus and as it branches out along this inner part of our arm, hooks around what's known as our medial epicondyle, and then runs down this side of our forearm and basically starts to serve our pinky finger, a little bit of our ring finger. So this is classically the distribution that's associated with hitting your funny bone. Now, if those symptoms that you're feeling there are rather persistent or they come on with certain activities, ulnar nerve flossing could be a great way to reduce those symptoms. How we're going to perform this ulnar nerve floss is by simply using a drill that I call the halo. This technique, you're basically going to take your arm and hand is going to be put into a little bit of what's known as radial deviation. So I'm going to take my hand and tip it towards my thumb side. So it's going to be extended, but I'm not going to tip away from my thumb side. I'm going to tip towards it, okay? Then I'm going to place this hand over my head and I'm basically going to trace a halo. And I want to keep my shoulder in a good position. I don't want my shoulder up here by my ear. Let's keep the shoulder in a packed position. So from the side here, overhead, making a halo. And then we can reverse that, same direction, okay? So from the front view here, we'll work one direction and then you can reverse that direction. And that would be an ulnar nerve floss.